Well, hello, everyone. Thank you so much for joining us this evening. I'm Dr. Daly, Superintendent of Schools, and I'm here with Dr. Trementosi, who is our school physician. And I'm just really excited to be able to share with you this evening some updates about COVID-19 testing in our schools. I'll give a sort of a brief overview of testing, speak specifically about symptomatic testing, and then also about asymptomatic testing, pooled testing that we're going to be looking at in the near future. Some of you may have joined us a few weeks ago when I gave an overview of the symptomatic testing, and so some of these slides may be familiar, but I wanted to just update and reiterate some of the important points that I made at that time. So we work consistently with our school nurses. We have one nurse at each school, plus this year we have been able to have an additional nurse to assist us with all the COVID-19 tracing in our schools. Our school physician who's here, Dr. Megan Trementosi, has been a wonderful asset to us in all of our planning and guidance for this year and approvals, and has worked closely with us on providing the standing order for both of these testing initiatives. So I want to thank her so much and for being here tonight. Our public health nurse, we meet regularly with a group from the town weekly. We met earlier today. Miss Pamela Vath has done this for us all year. She's been fantastic. And we have a new public health nurse who's coming on, Miss Donna Hovey. So we're looking forward to working with both of those nurses as well. We look for guidance from the Department of Elementary and Secondary Education, the Department of Public Health, as well as the Centers for Disease Control. We have those weekly COVID meetings, and at those meetings, we talk about things such as contact tracing, travel, vaccinations, and testing. And tonight, obviously, we're going to focus on our testing. The news is good. The numbers are going down, as I've mentioned in some of my communications. This week, we're in the yellow, which is great news. Hopefully, we're seeing those trends everywhere, but we can't let our guard down. We have to stay vigilant. And as I mentioned when I put out there, let's really be careful with any kind of gatherings in the coming week. Super Bowl parties, if we can make them virtual, that all the best, because we really want to be able to continue our commitment to staying in our hybrid model. So there are three different types of testing. I'm going to talk about two of them tonight. The PCR test, which is the most common. It's the most sensitive and specific. This is the one that many of you are familiar with as being testing of the RNA. That's sort of the gold standard, the PCR test. The antibody test is for immune response. This is a blood test, and that's not the test we'll be talking about tonight. And then the third type is the antigen test. So the Binax now came out of a Lawrence General Hospital clinical study. It has a 97.1 sensitivity and now a 98.6 specificity. It looks for the protein coding to be present. So more of the virus needs to be present in the patient in order to determine that they are positive. And so it provides a very good level and a very high level of specificity for positive individuals. And that's what we're going to talk more about tonight. So when we think of symptomatic testing, this is what the Binax now antigen test would be. It gives you results in about 15 minutes, and it gives us a head start on contact tracing. Asymptomatic pooled testing is to tell us when, to lessen anxiety around asymptomatic carriers. So what we would do is we would take pools of approximately 10 individuals. If those individuals were to test negative, then everyone in that pool knows that that entire pool is negative. If the entire pool tests positive, then we would have to have a second test called a reflex test. And again, we would use those 15-minute Binax Now tests to determine who was the true positive in that pool. And those who test negative would be able to go about their business as negative and asymptomatic. So I'm going to get into a lot more detail as we go on, but those are the two main types of testing we're going to talk about this evening. So to start with the symptomatic testing, just a reminder, this is not used for travel. This is not to allow people to travel or when they come back from travel. This test is used not for asymptomatic individuals and not for parents, guardians, or siblings. This is just for students and employees of the North Reading schools. Symptomatic individuals at this time, when you're not feeling well, you come to the nurse's office. The nurse will assess, and the nurse will send you to get a test. That test will come back in 3 to 5 days and determine what we need to do to begin the contact tracing. What this test will allow us to do is symptomatic individuals who test negative would still be sent home and still take a PCR test. However, those that are positive would be able to isolate immediately, and we'd be able to begin the contact tracing process and also telling all those close contacts to quarantine. So we'd be able to get out ahead of what we're trying to do. So this graphic helps to explain a little bit of what this looks like. The blue is what we have in place now, and you can see that it's just that waiting of 3 to 5 days in order to begin the contact tracing process, that we would be able to be much more efficient with this process with the BinaxNOW results. Now, it's very important to remember that students who test positive would be treated as a positive case. There'd be no delay in isolating, no delay in that contact tracing. It's no longer necessary. This is a change even from the last time I presented. It's no longer necessary to confirm with a PCR test the student who's positive. So that positive test now, the Department of Public Health and the epidemiologists in the state have said that it's specific enough that a positive is a positive, and we can begin that treatment right away. And then again, whether all symptoms or minimal symptoms, those students who are positive will be treated as a positive case and managed accordingly. If a student tests negative, they can return to school following a negative PCR test when they have reduced symptoms and when they've been removed from school for at least 10 days. And again, the numbers and the figures are changing. As you know, there's been updated guidance around quarantine and the dates and the times depending on different factors. So some of the dates in this presentation may change, but we will always go with what our school nurses are telling us as the most current and up-to-date information. But essentially, this data will provide us a lot of information for our nurses to make those informed decisions for students and staff who come down with minimal symptoms or with other chronic conditions. And a very important reminder is that staff and students need to continue to stay home when sick. So one of the concerns with symptomatic testing is that we say, well, I've got headache and some sniffles, let me go to school and now I can take the test. That is not the intention of this. This is really for those who are in school and start to develop symptoms as they're in school. And so we don't have a high number of folks that this is happening to now. And we would imagine that this would be limited because parents, students, staff are doing a great job of staying home when they're sick. And that's really helped us to stay open and to stay out ahead of this for this year. As always, with both of these tests, it's all about the consent. So there's prior consent for testing and data. If a test is administered, there will be follow-up with the families. And there's always opt-outs available. And anyone that opt-outs, you would just follow the current process. So if you have symptoms, you would be dismissed to be tested on your own at home. So with the Binax testing, we did send through the principal an email that should have gone to you. You would have received an email from Project Beacon. It would have had a code. So when you clicked on the email, it would have brought you through some very easy questions for you to provide your consent. And then at the end of that process, the code would have actually just been automatically entered. And that's how it works into the system. Once you provide your consent, if you come to the nurse's office, your name will be in the system. And from there, we were able to schedule the test. So if you choose to opt out for your child and don't want to participate, you just would not complete the process for consent. And you can I know there's some variables, whether you may consent for one child and not another for various reasons. Always reach out to your school nurse with any questions, but you can certainly make those choices and decisions as you see fit. So pool testing is a little bit different. So I want to speak about this now. It's certainly, the ideal would be to have an individual PCR test for everyone. That would certainly be cost prohibitive. We're aware of some local colleges and universities that are doing this, and that is costing in the millions of dollars for some of those schools to do the testing that they're doing weekly. And it's wonderful, and I wish we could do that, but we don't have anywhere near those kind of resources. But we certainly, as we negotiated with our educators unions and our paraprofessionals and other unions this summer, one of the topics that came up was testing as it becomes available is something we should certainly explore as a district. And so when this concept of pooled testing came along, it was something that I and our nurse leader, Ms. Colleen Reska, and many others have been following and paying attention to hear the possibilities of taking that cost and basically decreasing it by a factor of 10 if we're able to get 10 people in one pool to submit for the test, it would cost that much less. And then there's a follow-up step to determine who is the true positive. So we were still very interested in learning more, but at that time it was still cost prohibitive even for us to explore it as a pool. But what was announced in the very recent weeks from the Department of Education is through some of the stimulus funding they've received, they are able to support us for 6 weeks for free with pooled testing. And that is what we're going to talk more about tonight. So the big piece of this is we're still trying to figure out exactly what this model will look like for North Reading. So pooled testing is not for asymptomatic, it's only for asymptomatic students and staff, not used for travel, not for symptomatic individuals, and it's not used for those who've already had COVID-19. Because someone who has COVID-19 may continue to show up as positive, they would not be participating for 90 to possibly 180 days in these scenarios. So again, if the pool comes back negative, everyone knows that those pools are negative and we can breathe a sigh of relief for that testing cycle. If the pool comes back positive, the entire pool must take a reflex test. So those individuals, once those results come back, it takes 1 to 2 days for those results to come back. Those individuals would not be able to come immediately to school, but what we would do is we would set up a secondary site. The districts that have done this well, we've sat through panels with Salem, Medford, and Watertown have shared what they've done. They've had some drive-through lines outside. I'm just hypothetically using possibly like the auxiliary gym at the high school where we could set up a station for this. So if there is a small pool, you may not go to school the next morning at the usual time. You would come a little bit later after the high school and middle school are in session. We would do the 15-minute test, identify who in that group is the true positive, and that person would begin to isolate, and we would begin to contact trace, and those negatives would be fine and be able to go about their business in school. So that test, again, would be the Binax Now test. It's a 15-minute results, and it would give us that head start then on isolation and contact tracing. So if they're negative on that test and they have no symptoms, like I mentioned, they would be able to go about their business. So the Department of Elementary Education will cover this for 6 weeks of implementation. And it's not any 6 weeks. It's an exact 6 weeks, beginning on Monday, February 8th. You can see why the urgency for me to have this forum tonight to explain a little bit more. I'm going to send out a survey following this forum to just get a sense from families about their interest in participating as we make our decisions about what's feasible for North Reading. But it begins the week before vacation, no testing will occur during vacation week, and then it would be 5 weeks after vacation. So I want to be very clear in what I've been sharing publicly at school committee and other places that we do not plan to continue this beyond this coverage period. So there is some, the Department of Ed would love for us to continue this to go through the remainder of the school year, and they've mentioned that we could use what's being called the ESSER 2 funds, which are funds that are available to the district. Our rough estimate of what this would cost for the remaining weeks for the school year would be close between $150,000 and $200,000, which would be the entirety of our ESSER 2 funds. And those funds right now are being used for that sixth nurse that we have at all of our schools. It's being used for our technology technician support. It's being used for mental health supports as well for our students, especially as they transition back. And those funds could be used over the next 2 years to support some of those positions. And that's really where our focus needs to be. And so we are not planning to extend this beyond the year. But we do feel that this might be a great way to get this data to help us through the next 6 weeks or so, at which time our staff members, our educators, should be able to receive the vaccine. As you know, the children will not be receiving the vaccine at that time, as it will be something that's done later. But I think our schools will be even safer places once our educators receive the vaccine. Obviously, it's not the silver bullet. We're still going to be, wearing masks and keeping our social distance and following all procedures. But that vaccination timeline should be very helpful. So we feel that pooled testing should help give us more information over the next 6 weeks. So we right now are exploring the logistics. We're trying to figure out the pools, who's going to be in which pool. If you have staff members only. It's in pools of 5. We wouldn't want to have all staff members in a pool of 10 because of what I spoke to earlier, having that possibility that they may need to be out until they have their reflex test could increase the number of staff who are unavailable to be in our buildings to keep them safe. So we want to be very careful in how we design these pools to minimize any kind of disruption to what we're trying to do with our hybrid learning model. We do need to have everybody involved. Obviously, anyone who opts out, but anyone that's interested, we want to make sure that they're able to participate, but we don't necessarily need to begin right on day one at all 5 schools. And so we're going to think about which school or schools may be the best place to start, what the best way to do this is. The frequency of the test is recommended to be weekly, but we really have to look at our capacity for doing this with our nurses who are doing a tremendous amount of contact tracing, as you know, making all of the phone calls in addition to what they do every year as a part of their regular job. Now they would be working on testing. And so that would be an increased ask that we really have to examine what is possible. But our goal will be to do as much testing as possible to give as much information to people as possible. So that frequency is something that we're still considering. Again, the consent has to be granted for staff and students, and there'll be a similar process to what we've done now. We would be partnering with Project Beacon, which is very good. It should be seamless, and I'm assuming that the process for consent will be very similar to what we had for the first round with the Binax Now. I'm not exactly sure. We just got that confirmation that we'd be working with them about a few hours ago, and so I have more to learn in the next few days. Nurses and trained staff will assist in gathering the samples. So these samples will only take a few minutes to administer. They could be done during a mask break at school. The districts that have told us that this has worked, they've said it has not disrupted teaching and learning. It does not take away from quality time. It's really quick and easy to administer. There's a nasal swab, and it's a simple swab of the anterior of the nose. And then students in grades 2 and above and all staff would be able to self-administer the swab. They would be watched by someone who's trained and can give help and feedback. And then those students and staff would be able to put the swab into the kit, seal it up, and it goes into the collection area. The pre-K, kindergarten, and first graders would have that administered very closely by a nurse. And so that's how that process would work. The results would return in 2 to 3 days. As I mentioned, I think they've now said it's within 1 to 2, which would be even better. And those that would be in the positive pools would not return to school until after that reflex testing. Overall, what these schools that have done it, and again, these are much larger districts with many more positive individuals in town, they've had a less than 1% return of positive pools. So this has not caused some of the concerns that many of us might have. The positive cases are not reported until the reflex test results confirm a positive viral load. So if a pool tests positive, we're not reporting 10 additional cases for the town of North Reading. It would be only those that test positive on the second test. Most likely one person in that pool who tests positive would be reported at that time. So we should not see an increase to the number of positive cases. This would not be over-identifying. It would just be helping to identify those that are positive. And again, those negative results should provide reassurance on a weekly or bi-weekly, whatever we're able to come up with for frequency on that basis that you're asymptomatic. So again, the purpose of this, the reason we're doing this is to provide us with data to keep our schools safe and operating in our hybrid model. This is not collecting data to hopefully go the other direction. The purpose of this is to keep our schools safe and open, and we're all committed to that goal. So just very quickly about the vaccinations in Massachusetts, I'm sure you've all seen this. Our nurses were able to be vaccinated in phase 1, which is fantastic. Our educators will be able to be vaccinated in phase 2. There will be a lot more information coming about this in the near future. We're going to try to have as much local access to vaccinations as possible, but there is a good chance that a lot of the educators are going to be going to sites in the area, at some of the larger sites, to receive vaccination. So we'll be receiving more and sharing more about that as that develops. So just a few reminders, and then we'll take some questions as they come in. But I think it's very important, as I've been saying to everyone, that staff and students need to remain at 6 feet apart whenever possible, wear their masks, and wash their hands. This hasn't changed, and it's been working for us so well. We've had very, very low transmission in school. And just to clarify, as I've said a few times before, the reason why I'm saying very low transmission is, we have had a few instances where we're not exactly sure. Did it happen in the classroom, or did it happen when the two friends were at home on a play date? Sometimes there may be siblings in a situation. So I'm much more comfortable saying very low transmission than zero, because sometimes it's difficult to know where the transmission occurred. But we are not seeing in any way that there is transmission that is happening when we do our contact tracing and we're sending kids home in quarantine. Those students, we're not seeing a large number by any means of those students then turning positive. If we did see that, that's when we'd be having conversations about needing to do something differently with our model. So please continue to avoid large and small gatherings, as I've shared most recently with you. We're seeing, the town of North Reading has done a fantastic job of not having these large gatherings or parties, but it's very often those small gatherings when we least expect it. Everyone's in a small group of friends, people you've hung out with since you were in kindergarten, and then all of a sudden one of you isn't feeling well and tests positive, and then others start to test positive. So please be careful, and especially if you're in a group indoors and there are meals, whenever those masks comes down, make sure you're more than 6 feet apart. So if you're close and your masks are up, but as soon as you're taking that mask down, that's when the virus is really transmitting. So please keep that in mind. And as I've mentioned, as we're looking ahead to gatherings in the next week, if anyone's getting together for the Super Bowl, this is absolutely essential. Again, virtual parties, viewing parties are all the rage, and I highly recommend them. And a last reminder is just please continue to support our nurses and administrators in contact tracing. Our nurses and administrators are often working all night, all weekend now as these new cases come in to call you. It's never a pleasant phone call. No one wants to be told that they're a close contact and they need to stay home, or they need to miss an event that they were hoping to go to. This is a difficult call for us to make, and it's a difficult call to receive. But please give your extra additional support and follow those guidelines. Make sure if you're told to stay home, if you're told to quarantine, we need to make sure that we're doing those things. And everyone's doing a great job. These are just reminders of that importance. So at this time, I don't know whether Dr. Tramontosi had anything to add, or we can also take some questions. If I see them here, I can share them with the group.
I just wanted to thank you for having me on. This is a great opportunity. Again, I think your district is well ahead of the curve, and more information is better, and it'll allow more people to be in school safely. So you guys are doing such a great job.
Great, thank you. And I'm just going to see if anyone has a question. You can type the comments in, and I can share those with the group. I'll just give it a moment. We are going to be recording this, and I will send out a recording to those who couldn't join tonight. There is a very brief survey, and we ask that you complete that survey as soon as possible. Certainly by the end of the day tomorrow would be most helpful, because we want to get a sense of what the interest is based upon this information about whether you intend to provide consent and participate in the program. And certainly that is everyone's choice, but it really will help us to determine how we are to take the next steps and move forward. So at this time, I'm not seeing any questions. I hope I didn't make an error and prevent you from asking the questions, but certainly if you have questions, feel free to email me. I can try to answer those questions and compile them and share them out in some frequently asked questions. We did take a lot of questions earlier from the Department of Ed presentations, and I included those in there. So again, we've had a great opportunity to check in with our friends in Medford and Salem and Watertown, again, districts that are much larger than ours with with higher numbers of quote unquote red in their community, and they are seeing less than 1% in the pools. And I do think, as Dr. Tramatozzi said, these are all steps that we can take to try to make our schools safer. And so hopefully that will be our next step, and I'll have more to share out on this very soon. So thank you so much. I agree, Dr. Tramatozzi is the best. I'll put that up there so everyone can see it. And it shows me also that our question form did work, so that's great. If there are any other questions, you can throw them up there. I'll hang out for just a minute, see if there's any more. Okay. Well, thank you, everyone. Thank you so much. I hope this was informative for you and can help you make a more informed decision about consent. And if you have any questions, as always, please reach out. Thank you so much and have a great evening.